listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we've got a ton of information for those of you ready to sell health insurance plans to the under-65 market. We have packed this episode with info on the ACA exchanges so you can feel confident pursuing a new line of business. ACA 101, Selling Under-65 Health Insurance, written by Roxanne Anderson. If you're looking to expand into the under-65 health insurance market, you might be wondering, where do I start? You don't have to wonder too much because we're covering the ins and outs of the Affordable Care Act and selling under-65 health plans. The American Rescue Plan Act of 2021 expanded the Affordable Care Act, or ACA for short, improving health insurance affordability to those younger than 65 across the board. There is no better time to enter the under-65 individual health market than now. So we're giving you all the info you need to know to get started. Let's start with a simple breakdown of the Affordable Care Act. The ACA is a federal law signed in 2010 that reformed America's healthcare and insurance landscape. Formally known as the Patient Protection and Affordable Care Act, and colloquially called Obamacare, the ACA includes several key provisions that gave 20 million Americans access to affordable health insurance coverage. Here are some of those key provisions of the ACA. The creation of health insurance marketplaces or exchanges. The individual mandate, which required every American to have health insurance or pay a tax penalty. People with pre-existing conditions cannot be denied coverage or charged more for it. Children can stay on a parent's plan until they turn 26 years old. Preventive care at no additional cost. Subsidies or tax credits for qualifying individuals or families purchasing through the marketplace. And the expansion of Medicaid for low-income adults up to 138% of the federal poverty level. The individual mandate penalty was repealed at the federal level in 2019. A select number of states have since implemented their own health insurance individual mandates and penalties. These include California, the District of Columbia, Massachusetts, New Jersey, and Rhode Island. Vermont has their own individual mandate, but they do not have a penalty associated with it. Now that we've covered the ACA origin story, why is selling under-65 health plans a great opportunity? Well, a few years ago, things looked a little bleak in the ACA market. Several carriers left the marketplace and state exchanges, and the ones who stayed cut commissions for agents and brokers selling these plans. You might be thinking, Sarah, you just said it was a great opportunity. It is. A lot has changed since then. Now, the future of this market is looking exceptionally bright for everyone. Carriers, agents, brokers, and consumers. Why? Well, to start, let's talk about those ACA commissions. Carriers are once again offering commissions, and they're pretty great. Just like with Medicare Advantage, Medicare supplements, and prescription drug plan sales, agents can earn new and initial commissions in the first year and renewal commissions in the second year and beyond. Unlike in Medicare sales, ACA commissions are typically paid per member per month. What's more, a large number of people are eligible for ACA subsidies. The American Rescue Plan Act of 2021 expanded federal health insurance subsidy access for millions of Americans. Before, households just above 400% of the federal poverty line, which is the limit for subsidy eligibility, made too much to qualify for an ACA health subsidy. Thanks to the 2021 Act, the income cap is now at 8.5% instead of 9.5%, allowing more households to qualify for financial assistance. In August 2022, the Inflation Reduction Act of 2022, IRA for short, extended subsidies for an additional 3 years through the end of 2025. Individuals will be able to be evaluated for subsidy eligibility each year, and if they qualify, can receive subsidies to apply to a marketplace plan. It is important to remember that clients who choose to accept subsidies must report them at tax time to capitalize on savings for the upcoming year. Also, selling ACA plans may only require one certification at no cost. If you sell Medicare Advantage and Part D prescription drug plans, you'll be familiar with AHIP, which is a federal requirement, and carrier certifications. In order to sell under-65 health plans, insurance agents must also complete a federal certification, the Federally Facilitated Marketplace, or FFM certification. Carrier certifications are not required. FFM certification is also completely free, unlike AHIP. Agents and brokers new to the ACA marketplace must complete the full individual marketplace training. Those who are returning to the marketplace are eligible to take a shorter training with optional review modules. Anyone wishing to proceed with FFM training requirements can find and complete them on the Centers for Medicare and Medicaid Services Marketplace Learning Management System, or MLMS. The process for FFM certification is pretty simple. In fact, just 6 steps. Number 1, create an account on the CMS Enterprise portal. Returning agents and brokers can log into their current account. You guys can proceed to step 4. Number 2, navigate to the FFM training for agents, brokers, assisters. Number 3, confirm your identity. Number 4, click on the Complete Agent Broker Training link on the Agent Broker Registration Status page in the portal. Number 5, complete the training and exams. That will be vendor or CMS training through MLMS. Finally, number 6, sign the CMS privacy and security agreements. That's pretty much it. For more info on the exact certification process, make sure you're following along with the show. We've got a lot of ACA content in the works, as well as more information linked in the episode notes. Again, once you have completed this training, you should be good to start selling ACA health plans. Just keep in mind, select states may require additional certification training. If you need another reason to add ACA plans to your portfolio, they can widen your net of potential customers, and they work nicely with the products already in your current portfolio. If you're already selling other insurance products, like Medicare plans, why not add under-65 health plans to your portfolio? You likely work with clients who are under 65 or who have spouses or kids who are under 65 who need health insurance help. When you add ACA health plans to offerings, you can better serve your current clients and any referrals that come your way while growing your commissions. Plus, your under 65 clients will eventually become leads for your Medicare business or the other products you sell. Next, if you're going to start selling under 65 health plans, you need to know about the ACA marketplace and exchanges. First up, what is the ACA marketplace? The ACA marketplace, also known as the Federal Health Insurance Marketplace or exchange, is a website where Americans can go to buy under 65 health insurance plans. This website is healthcare.gov. Some states have their own marketplace websites or exchanges. For example, here in Pennsylvania, we've got Penny. Let's take a look at on-exchange versus off-exchange plans. ACA health plans are available on the exchange or off the exchange, and we refer to those simply as on-exchange plans or off-exchange plans. Very simple, plans available on the exchange include those bought through healthcare.gov, those bought on a state's exchange website, or those bought through an approved exchange enrollment platform like Health Sherpa. Off-exchange plans are those bought directly from the carrier. On-exchange plans must provide essential health benefits and follow specific guidelines set by the ACA. Only on-exchange plans can accept ACA subsidies. Off-exchange plans usually offer most, if not all, the essential health benefits as their on-exchange counterparts. However, individuals cannot use an ACA subsidy to buy an off-exchange plan. Only on-exchange plans can accept ACA subsidies. Just like Medicare products, ACA has its own open enrollment period and special enrollment periods. Every year, people can shop for and enroll in a new under 65 health plan on the marketplace during the open enrollment period, or OEP, which runs from November 1st to December 15th, or during a special enrollment period, SEP. Your client may have an SEP if they've recently experienced any of the following: job loss, moving to a new zip code, new child or death in the family, coverage loss, marriage, divorce, citizenship status change, government error, change in subsidy eligibility, or a qualifying federal reason. As of 2022, new special enrollment period opportunities became available to your clients. One for individuals who did not receive timely notice about a qualifying event, and another for those who lost employer contributions or government subsidies for continued employer health coverage under COBRA. To take advantage of an SEP, you and your clients must act within 60 days of the qualifying life event. Moving to ACA subsidies and their eligibility requirements. Today, more Americans are eligible for ACA subsidies than ever before, thanks to the American Rescue Plan Act and the Inflation Reduction Act. What are ACA subsidies and how do people qualify for them? Well, ACA subsidies are an advanced premium tax credit designed to help lower income and middle income individuals and families afford health insurance. To qualify, someone must have income between 100% to 400% of the federal poverty level. Coverage must be bought through the marketplace or exchange. And finally, they must not have affordable employer-sponsored coverage available to select. For 2023, family members can access subsidized ACA coverage if an employee's cost for their coverage exceeds 9.12% of the household's income. This is thanks to the closing of the family glitch. all family members will now be taken into consideration in the eligibility calculations, not just the employee. And a quick note here, individuals who fall below 138% of the FPL or their state's designated limit should qualify for free or low-cost health insurance through Medicaid. If your client lives in Hawaii or Alaska, please be aware that poverty guidelines differ, and you can review those states' guidelines and your state's guidelines on hhs.gov. When helping your client apply for a plan, you'll work together to estimate how much income they think they'll have for the year. Then they'll receive a subsidy based on that income estimate, as well as additional factors. When your client files their taxes at the end of the year, they may have to pay back some or all of the subsidy if they earned over their estimated income for the year. Alternatively, if they made less than their original estimate, they should get a refund of any additional portion of the subsidy they may qualify for. To recap so far, we defined the ACA, heard the origin story, talked about adding it to your portfolio, eligibility, certifications, the marketplace, exchanges, enrollment periods, and subsidies. A lot of information, I know, but we're not quite done yet. Let's go over the ACA coverage levels. Under-65 marketplace plans are categorized into 4 metal tiers: bronze, silver, gold, and platinum. Basically, these tiers can tell you and your clients how covered medical costs are shared between the policy and the policyholder, but not the level of care or the plan's covered services. We'll start with bronze. 60% of covered medical costs are paid by the policy, while 40% are paid by the policyholder. These plans have the lowest monthly premium comparative cost, but the highest unsubsidized annual deductible comparative cost. Bronze plans are not eligible to apply a cost-sharing reduction, but they are eligible to apply a premium tax credit. Next, silver plans. Silver plans split the costs 70-30, with 70% of covered medical costs paid by the policy and 30% paid by the policyholder. Silver plans are the only plans on the marketplace eligible to apply a cost-sharing reduction. Like other tiers, silver plans are also eligible to apply a premium tax credit. Moving on to gold, 80% of covered medical costs are paid by the policy, while 20% is left to the policyholder. Monthly premiums are high, but gold plans have a low unsubsidized annual deductible. Gold plans are not eligible to apply a cost-sharing reduction, but are eligible to apply a premium tax credit. Last on the metal tier list is platinum. These plans split costs 90-10. So 90% of covered medical costs are paid by the policy, while 10% of covered medical costs are paid by the policyholder. These premiums will be the highest in comparison to the other plan tiers, but the unsubsidized annual deductible will be the lowest in a platinum plan. No cost-sharing reductions on platinum plans, but they are eligible for a premium tax credit. As the metal tiers go up, the member's coinsurance responsibility goes down, while the plan's coinsurance responsibility goes up. The most prevalent tier in the marketplace is the silver one, because that's where the cost-sharing reduction comes into play based on the income level. It's the most aggressive plan for your client if they qualify for a subsidy. Here's where the agent advantage comes in. You may know that navigators are also available to help individuals find and enroll in on-exchange plans. However, there's a big difference between navigators and agents or brokers like you. Navigators cannot recommend one plan over another. You can help your clients understand the best plans for them based on their needs. By getting involved in this market, you're looking out for the best interest of your clients and yours as well. Under-65 sales can increase your bottom line and keep your book of business booming for years to come as the market is stronger than ever. The ACA health market has seen a lot of changes within the past few years, especially this past one. Here at Ritter Insurance Marketing, we're embracing the amazing sales opportunities that the ACA and American Rescue Plan Act present. We've jumped into the marketplace, and we hope you'll join us in selling under-65 plans. To learn more and for future reference, check out our comprehensive agent ebook, The Complete Guide to Selling Affordable Care Act Insurance Plans. It'll help boost your confidence and help you get started. We will have the link to get your free copy in the episode notes. If you have any questions or concerns, please reach out to our team. You can email us at asgpodcast@ritterim.com or leave a voicemail on our hotline at 717-562-7211. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.